Incorporated. I'm your host, Corey Lane. On the line, we have Attorney General Dale Marshall, COVID Czar, Mr. Richard Carter, and Dr. Anton, Chief Medical Officer, to answer all your calls and queries re COVID-19 and the national response to this pandemic. Now, before we went on the break, we were asking a number of questions, and one of the questions that continue to arise here on the WhatsApp and the other platforms we're using is about the response of those who are at home, the elderly, etc. And we have COVID Czar, Mr. Richard Carter. I want him to lay out government's plan and response in relation to the vulnerable communities among us. Mr. Richard Carter, are you with us?
Yes. So, Corey, I just wanted to take this opportunity to ensure that persons are aware of the range of responses beyond the medical that the government of Barbados is taking in relation to COVID-19. The Prime Minister would have announced the Adopt Our Families program, where persons of high net worth or above average net worth have been invited to come forward to support vulnerable families based on the understanding that persons who are vulnerable, their vulnerability extends to us in a situation where we have a disease that basically is not discriminating. We have set up a WhatsApp number to receive indications of interest in supporting vulnerable families. So this is for persons who want to come forward and support vulnerable families. You can WhatsApp your interest in doing so to 255-1000. 255-1000. A second program that I want to just give quick mention of is the Vulnerable Household Support Program. Now, we are very fortunate in Barbados that we have a social protection system that essentially has kicked into gear and, in fact, is the envy of many countries in the world. We were able to go immediately to a list of vulnerable households that had been created by the Ministry of People's Empowerment and Elder Affairs. We are currently in the process of expanding that list with a view to meet the proposal of the government of Barbados to identify the 1,500 most vulnerable families in the country and provide them with a monthly program of support that will allow them to ride out the crisis, and so that their vulnerability, as I said, does not exacerbate the situation that we are currently trying to manage. Our intention is to roll out that program within the next week or so. We are in the process of finalizing the list of vulnerable households. Let me just say that for those persons who consider that their circumstances are so dire, persons who are in extreme poverty and think that they really need to get the assistance of the government, I am asking those persons to call the hotline number of the Ministry of People Empowerment and Elder Affairs, 536, or rather to WhatsApp the Ministry of People Empowerment and Elder Affairs, 536-HOPE. Send a WhatsApp message to 536-4673. Your message will be logged, and one of the welfare officers who deals with these matters will be in touch with you to ensure that your circumstances are investigated. The last thing I wanted to say, Corey, is in respect of our 70-plus population. Now, we've been saying all along in the COVID-19 response, we've been talking about the special vulnerability of elderly persons. They are more likely, if they get infected by COVID-19, to have adverse outcomes or to require extensive medical intervention. One of the things that the government of Barbados has determined that we will do is to reach out to those persons who are 70 years and over across the island, with a view to identifying those persons who need help either in purchasing their groceries because they have no one living in the household, or because they have no one that they can call on to do those things, or with a view to helping them to access and purchase their medications, because our ultimate objective in this is to protect that vulnerable sector of the population from exposure to the basic, the rest of the public. And in this regard, therefore, persons 70 years and over can expect over the next week or so a call from the government of Barbados officials. They will identify themselves as such. with a view to trying to determine if you need extra help in purchasing those items and in protecting and allowing that segment of the population to remain at home.
Okay, and anyone have any further questions can ask follow-up, and I'm sure you'll be able to answer in relation to that. Before we go back to the lines, just to get some of the questions I pull off of the WhatsApp and put them together, are there any parts or plans to close the airport at any time? Does Stage 3 have any plans to shut the airport at any time?
At this time, there are no plans to close the airport. We've always maintained the stance that we will keep our borders open, and that is going to continue. I can tell you that even now, individuals are reaching out to us in relation to shipments of food and medical supplies that are much needed. The hospital has quite a bit of stuff on order. The Barbados Drug Service has quite a bit of stuff on order. And some of these things are going to have to be brought in by air, others by sea. Barbados needs to be open, and so there's no plan for us to close the airport or seaport at this time.
Okay, good. In terms of the cases, are any people are wondering if we have any recovered cases or any persons doing well so far? How are the 33 confirmed cases doing?
So out of the 33 confirmed cases, all are in isolation, and the vast majority of them are mild, and some are what I would consider moderate, and that we're keeping our eyes on very closely with a guarded optimism.
Anyone towards recovery?
In terms of recovery, it's way too early. This is not even 2 full weeks of having our very first case.
Okay.
And
sorry, go ahead.
Sorry, go ahead.
No, you go ahead. You go ahead.
Right. Yeah. So we're not even 2 weeks into the start of this epidemic. We have tested people who have recovered in terms of their symptoms, but when we retested them, they're still showing positive. Mm-hmm. So only when that test that we use for diagnosis turns out negative can we say that that person has definitively recovered.
Okay. Any plans to announce the places? We don't want names. We want to know if we can announce the places where the confirmed cases have been.
Anton, let me jump in here
Sure.
because we have had what I consider an unhealthy curiosity among Barbadians in relation to trying to identify individuals, trying to identify places, trying to identify all manner of things. And my question back to persons who will want that information is, of what value is that to you? How will that help you improve your hand hygiene, improve your respiratory hygiene, improve your requirement to remain in your home? And the second thing is that we have an absolute requirement to protect patient confidentiality. And we know how small Barbados is, and releasing even things such as the locations will go some way to helping people to identify individuals and begin the unhealthy finger pointing. The third thing is that protection of the identity of persons who we are treating is not only important from a patient confidentiality point of view, but we want to avoid the stigmatism that will almost inevitably attach itself to the identification of persons and potentially drive the persons underground that we desperately want to reach. So for all of those reasons, there is no intent to reveal any more information to the public that would be helpful to them.
For me,
Richard, let me just add that if we get into the habit of revealing too much information, it could also impair our contact tracing efforts. So we have gotten a lot of calls about, where people live and, where did the people work and all of that. And we have to be very careful. Us working in health and the public health teams, especially who are on the ground doing a lot of the very laborious work, they need to know that information. If we put that information in the public domain, there can be more panic than is necessary, and it can actually impair what it is that we're trying to do as we try to identify persons who are at risk and try to contain the spread of COVID-19.
For me, I've told persons personally, and the argument really is that persons' confidentiality should not trump national health security. But what I've been telling persons is that assume they've been everywhere and keep your hygiene at the best practice level, full stop. I think that's the best way to operate in these times. All right. In heat, a lot of speculation about heat and how heat treats the virus. Let's deal with that front. Does heat kill the virus? Does heat have any effect on the virus?
So Corey, I'm going to answer that in two ways. A lot of people have been wondering about COVID-19 in tropical countries because there was a theory initially that it's not going to spread as much in tropical countries. And what WHO said is, well, look at your Singapore example, where Singapore is considered tropical, and it was spreading there. But they were, however, able to contain it. We're only 4 months into this, what started off as an epidemic in Asia, which is now a pandemic. There's still a lot that we're going to learn, still a lot that we need to learn. So to make any definitive statements about temperate climates versus tropical climates, we can't at this point. All we can say is that it appears as though the climate does not change the course of the spread of the disease so far. Okay. The other part of the question, or the other question rather, about heat is, yes, high heat can kill a virus. High heat can kill germs. So, for instance, if you are sanitizing in general, you can use boiling water, and I'm not talking specifically for COVID. I'm looking at what you can do to kill germs in general, and that is why you would recommend boiling water or very hot water to be able to clean surfaces in some instances.
Okay, good. All right, a couple more, and then we go back to the lines. What about support services for banks? Companies that print statements and checks, are they exempt?
There are a number of printing companies that have sought exemption. I think I could say that it seems as though most people in Barbados want to keep working.
Industrious nation.
Companies that are doing printing that is vital to the COVID effort are being granted exemptions. So, companies that are producing labels for medicine, labels for hand sanitizers, labels for disinfectant, those companies are granted exemptions in certain circumstances. Now, I think you can see the logic behind this, because in terms of medicines, they have to be clearly labeled. To do otherwise would be reckless and irresponsible. In case of disinfectants, hand sanitizers, all of those require proper labeling. And therefore, in those circumstances, yes. But a company that is looking to print checks and looking to print statements and looking to print posters and envelopes and all those kinds of things, it is not business as usual. And therefore, I could see no reason why such a company would be given an exemption to operate. That operation could not easily fit within a description of being in support of our vital interests at this time. And let me say that in most instances where individual entities have requested exemptions, I think I said it before, we have asked them to demonstrate a clear willingness to cut back on the number of staff that they're going to be using. And in some instances, we've been able to get companies to agree to operate with as few as 10% of their normal staffing complement.
All right, we're going to go out to the lines and I'll come back to some more of these. We're trying to do a balancing act here. So let's say good afternoon and welcome to our next caller. You're on the air.
Good afternoon.
Hi, good afternoon.
Yeah, this kind of best. I'm calling in relation to two issues. One, in relation to the PSB industry, what has really operators and owners felt that they were slighted by government and not making the necessary provisions for them in relation to the fall off in passengers. This is traveling on the, because of the guidelines laid down, where you have to have a reduction in the amount of people by 50% in the PSC. And one of the requirements that is required for PSVs that are a minibus is for persons must have clearances like national insurance clearances as well as income tax clearances, which means that owners and operators are contributing to the National Insurance Scheme. But when government made their decision, they did not at any stage talk about the PSB industry for any fall off or any compensation for them. And I can tell you that that is one of the burning issues. My other issue is in relation to our food import bill is very high, and we, at this stage, I'm not sure. I've heard the Minister of Agriculture who indicated that we are doing some 6 weeks crops, but we also have traders coming from our Caribbean neighbors like St. Vincent and St. Lucia, who plays a pivotal role in helping supply Barbados with foodstuff. This question is probably open to the Attorney General as to what do those traders do with their produce when they bring them to Barbados during this curfew or during this period.
I think we had a slight dropout there of our conference call with the authorities. The producer and technical operator is on that right now and trying to get that sorted. So I'll hold your two questions. Your questions in short is about the NAS payment, and the second one is about, could you just repeat it succinctly the second question? Are you trying to get that back sorted as well? In the meantime and in between time, I hope that they're listening. I want to ask the Attorney General also about a notice that's been sent here by the Barbados Port Inc. And it says it's a message to their staff, and it says that please be informed the Port of Barbados, while listed among Barbados's essential services, will be operational only to service cargo vessels during the period March 27th to 2020 to April 14th, 2020. Container part will open only to support work of vessels in Shed 2, and Shed 4 will remain closed to deliveries. Only staff, engineering, marine, terminal operations, PMMP, and security direct services to support the active vessel operation will be required to attend work. Now, earlier we talked about the essential stuff in storage, and this is counter to that. So I would like to get a response from the Attorney General on that.
Corey, we were offline for a couple of minutes, so none of us heard any of the questions that were asked, I'm afraid.
Okay, we had Kenny Best from the PSV Association. He was asking about NAS contributions in relation to the workers, and there was a second question I was trying to clarify, but I lost him as well. So if he can call back and ask that, we'll get that clarified. But I have a official notice here from the Barbados Port Inc., and they were actually going counter to some of what we've heard, and I'll read it again. It says, "Dear colleagues, please be informed the Port of Barbados, while listed among Barbados's essential services, will be operational only to service cargo vessels during the period March 27th to April 14th. The container part will open only to support the work of these vessels. Shed 2 and Shed 4 will remain closed to deliveries."
I must say I don't know the specifics of the operations of the port, but let me say that I think I've said before, our overriding objective, you know what that is? We are committed to supporting food, medical supplies, and such things as are vital to the proper running of the country's essential and priority interests at this time. From the discussions that have been had with the port, our understanding is that cargo vessels will be allowed to come in. Cargo vessels will be allowed to discharge their cargo. But in as much as businesses are closed, the concept of the idea of getting cargo from the port to a closed business is obviously not consistent with what we're seeing. So the only cargo that is going to be processed and allowed out of the port will be cargo that is destined for essential services, food supplies, medical supplies, and things of that sort. But a shipment of books, I'm afraid not. A shipment of clothing? I'm afraid not. A shipment of car parts? I'm afraid not.
Okay.
I don't know. I don't know what shed is which shed. I don't know those inner workings of the port system.
Right.
But I hope that I'm explaining what our country's priority and focus has to be over the next 2 weeks.
Well, I am reassured by the fact that this is your instruction, and I'm sure if it was a mix-up in communication, that it would be started. I only read it because it came from David Ellis. He's forwarding it on, and it says that these sheds actually deal with food supplies, pharmaceuticals, animal feed, and essential supplies. So I'm sure that could be sorted out in the background. We have Kenny Best back on. Mr. Best, just to repeat your question in summary to the panel, please.
Yeah, I want to find out because we do not provide all of Barbados with our own food and we import a lot. The traders who come from St. Vincent and from St. Lucia who brings produce, food stuff to Barbados. And as we know that Barbados is almost closed down, how does those people dispose of those crops that they bring up to Barbados for the benefit of the population during this period?
Well, we keep saying that Barbadians are going to be allowed to eat. We need our nourishment. Food is one of our basic necessities. Now, I've also just said that people who are cargo that's coming in through our port, as long as it's food stuff, will be allowed to be cleared. Now, we do not propose to shut down food businesses. Okay? So I don't foresee any difficulty. I don't know what the specifics that Mr. Best has in mind. I don't know what those are. But we want Barbadians to have access to food. That's why we've opened the markets. That's why we're saying that butchers can still function. That's why we're allowing farmers to operate. No, it isn't everything that we've been able to put into writing, but let's follow the principle. If we're going to say that farmers are going to be allowed to deal with their production, then those farmers have to have the opportunity to sell. That therefore means that whether if you're a wayside vendor of vegetables, we don't have any interest in shutting you down. You need to supply your customers. I can't see that there'd be any logic behind operating in such a way as would prohibit an itinerant vendor who comes up from wherever it is in the Caribbean to sell vegetables, from clearing those vegetables and from operating their business as usual. If there are issues in relation to COVID that those persons have to deal with, well, then that's a different issue.
Okay, we have some feedback there. Mr. Kenny Best and AG, I just got an immediate response from Lisa Cummings, chairperson of the Barbados Port Inc. She said the notices were updated just over 24 hours ago, and they will allow on stuffing of those things except for personal effects. So that is going on their social media page as well. I'm speaking to her in real time. So I think that answers that. That message was updated just about 24 hours ago. So that should answer the query of the person who would have sent on the message. So there you go. Radio works. Moving on. Brass Tacks Sunday, good afternoon. You're on the air. Good afternoon. We're going to ask callers. I know sometimes you listen to the radio and not through the phone directly, but please try to listen through the phone. You're close to the phone. We can keep the calls flowing. Brass Tacks Sunday, good afternoon. You're on the air. Good afternoon and welcome. You're on the air.
Well, I joined the program late. Don't know if this question was answered or asked. If I have renovations going on at my home and one person is doing these renovations for me, can this person still continue doing the renovations?
Mm-hmm. Well, ma'am, I understand what you're asking. We are operating on the basis that business will not continue as usual. I don't know that there's a case for making a great distinction between one person or two persons or three persons or 10. The directive says that construction businesses are closed just like any other business. So if you're engaging a carpenter and it seems like now is a good time to have him come because his construction company is closed, I have to say we didn't contemplate that situation. but it could easily get out of hand because somebody might then decide, well, this is a good time to bring in 5 or 6 people. So let's stick with the principle. There are going to be inconveniences, yes. In a similar vein, people are asking, can my maid come to work? And I'm saying to them, no, your maid cannot come to work. They're asking, can my gardener come to work? And we're saying, no, your gardener cannot come to work. As inconvenient as it is, that is not what we're looking to accommodate at this time. So whether it is one carpenter, one maid, one painter, or one gardener, that is not going to be allowed.
I actually saw a joke online and I shared it. We need as many jokes as possible in these times where the maid and gardener say they can work from home, they can send instructions on what to do. So that's their way of working from home. And I thought that was very funny and very apt.
Thanks for that bit of humor. I think we know what chaos without pain in those households, right?
Everything outside the door.
Absolutely.
All right, let's take some more calls here quickly as we approach the end. We'll probably go a little over because there are many questions that are still unanswered, and I think this is way too important to rush through. But let's say good afternoon and welcome to our next caller. You're on the air. Good afternoon and welcome. Let's get a call up, please. Good afternoon and welcome. You're on the air. Brastats, good afternoon. You're on the air. Hello.
Oh, Corey, can you hear me?
Yes, please. Go ahead.
Right. Seeing that transportation has been exempted from the curfew, this would also include the use of taxis as well?
The transportation, okay, let's back up a bit. We are exempting the provision of transport services. Okay? Now, in some instances, we're going to allow the markets to work. A taxi man who works from the airport will find he has very little work. A taxi man who is working in Bridgetown will also find that he has very little work. So apart from the prohibition, the market forces are going to dictate that a lot of those services will be off the road. In the case with COVID, though, I think we know that physical distancing is important, and I don't know, Anton, if there's any science emerging where you prefer people to take a taxi as opposed to catching a bus or catching a ZR van. That's not within my remit. But certainly PSVs are going to be allowed, and we have that specifically exempted, but taxi services are not specifically mentioned. But I think that the market, our concern really has been how Barbadians who don't have their own car are going to be able to get about at this point in time.
Anton, we have Anton on the line?
Yeah, sorry,
okay.
I'm sorry. With regards to taxis, the Ministry of Health just last week put out some guidance for transport operators. So we looked at buses and we looked at taxis. What we advise for buses in terms of the physical distancing that we are recommending is we said no more than 50% capacity for buses. In terms of taxis, we didn't apply that same metric. What we did say, however, is that persons should sit in the back seat to create that distance between the driver and the passenger. And then the other pieces of recommendations that we made were frequent cleaning of the vehicles, and of course persons who are sick should not be taking public transportation or taking taxis, and nor should the workers, if they're sick, should they be coming to work.
All right. Roger that. I see a question here. Someone says his girlfriend is pregnant due next week. If she's having complications, if he can take her to the hospital if the ambulance doesn't come. One of the things I want to highlight here, you guys can correct me if I'm wrong, with the curfew, it was said that if you're on the road, you better have a reasonable excuse. And I think that will fall under that.
That is correct. Corey, we want people to be logical. We want people to be practical. And I understand the concern. I understand the fear. There's some people who have already contacted me this morning to say that the police stopped them last night and asked them why they were on the road. They had a good reason, but they were a little bit fearful of the response. In a situation, when I spoke to VOB earlier today, I said to VOB that there were some people who were on the road because they had to go to the police station to report incidents. Now, there's no sense in which a person would consider that to be an actionable breach of the curfew. And anybody who has to go to seek medical attention, that's not going to be considered to be an actionable breach of the curfew. So if your girlfriend is pregnant, sir, I think you all have enough anxiety at this point in time. Just take it easy. Rest assured that you will be able to do your duty and take her to the hospital if you're required to do so during the curfew blackout period.
Correct. Best of luck and congratulations in advance from all of us. Rasat Sunday, good afternoon. You're on the air.
Good afternoon.
Hi, good afternoon.
This is Corey.
Yes, please.
Corey. Yes, there's two quick questions I want to ask, and I will put down and hear your response or hear
the panel response.
Right. Seeing that people have to do emergency traveling, like go to the market, the pharmacies, and maybe banks, is it that the tire shops would be open, at least with decent staff to accommodate flat tires or anything like that? And second question, seeing that you're asking people to do a little home gardening, is it possible that they can get soil related to this? So I will put down here the response.
Tire shops, we've got requests for exemptions from tire operators, big tire operators and small tire operators. And I mentioned earlier that some of them say, well, we supply the ambulance service and we do this and we do that. We are going to grant exemptions in circumstances where the need is critical. There's a difference between stuff that is mandatory in the context of this COVID epidemic and stuff that is optional. There is a curfew. There are certain restrictions that go with it. It's not convenient. We don't like it. But everybody will have a good reason why they want this done. And I'm afraid, sir, that I cannot exempt tire shops from this requirement.
And soil for gardening, same thing. About soil for the gardens, I mean, absolutely.
Well, let's put it this way. Well, you know,
but that is still farming.
It is farming, and therefore we're going to accommodate farmers. This morning, I granted an exemption to a company that says we support the farming industry. We provide them with fertilizers and so on. And we can't say that farmers are going to be allowed to work from 5 until 6, but they can't get fertilizer. So we're not going to place that kind of restriction.
So if the soil is for your bougainvillea or your crotons, is a no-no. If it's for the carrots and the broccoli, is a yes.
I'm not going to make the distinction now between horticulture and recreational gardening and things of that sort. Otherwise, we would have a society that's unmanageable. I mean, if somebody has soil, I don't want anybody to be asking them, is this for your bougainvillea or your roses, or is this for the sweet potatoes? It would be senseless to make that kind of.
So anything that supports farming as a critical and essential thing, we support it.
Will be allowed, absolutely.
One of the things I was trying to do was to get hold of a pharmacist that you may know of, AG, Adrian Medic Ford. Listening to the 66 session of Parliament, he was making at the end, I was listening to it just the other day, about the whole idea of people and the medication, the ibuprofen, the dangers of it. And I was actually trying to get him online because I have many questions here in relation to people who have stockpiled these medications and wanted to know. They've listened to international media and they're hearing about these concoctions. And I want people to be really careful at this time, especially. I don't think we need to put any additional strain on the hospital with people going mixing up these chemicals. I think we have him online now. Do we have Minister Ford on the line? Minister Ford?
Hi, good afternoon. Good
morning, Adrian. Good afternoon, Adrian.
Thank you for joining at short notice. I want you to wear your other hat, and I was just telling the panel about the presentation you made at the 66th sitting of Parliament, where you spoke about the meds and so on. Now, there are a lot of people out there listening, particularly the mature in our society. They've gone to the pharmacy, they've stockpiled some medications, but I think I need them to be careful, and you need them to be careful as well, and I need you to speak directly to that from your experience.
Well, first of all, let me thank my minister colleague and the Czar, and of course, Dr. Anton Best, who has been doing an excellent job thus far. And let me also raise my right flag to say a special good afternoon to Minister Bostic, and of course the Prime Minister who has led from the front as far back as December when we first heard about this COVID illness. My presentation at Parliament, I would have made some submissions about medication. It is a known fact for you that we have an aged population in Barbados. About 70% of our population, if you look at 300,000 as the number, about 70% or about 51,000 are over the age of 65. 11% over the age of 65. They suffer from chronic illnesses. Diabetes, we have persons who suffer from hypertension, rheumatoid arthritis is a big concern. And we know they are given a whole myriad of medicines. We call them, for pain, we call them non-steroidal anti-inflammatory drugs. Now, these drugs are very good for pain. They can bring down the fever. In this current episode, what my plea to Barbadians, and especially the elderly, if they are having signs and symptoms of persistent cough, high fever, breathlessness, tiredness, dizziness, or difficulty in breathing, at this point in time, I would not advise them to be using any of the prominent non-steroidal anti-inflammatory drugs. And there are a whole list of them. I will go through the list very slowly so that the elderly folk at home and those persons in earshot will be able to identify with these products. What these products do, and Dr. Best and the NFE choose to, is that they can exacerbate the condition when you have a viral illness. And we don't have to be necessarily talking about the coronavirus. It could be any viral illness. They are not supposed to be used during a viral episode, point blank. And you would heard cases about the corona and the ibuprofen usage in certain parts of the world, especially Italy, for instance. They had some cases. There's a case, for instance, where a child got a condition called empyema, where there was pus and bursting of the cells in the lungs, which would cause, of course, pneumonia and bronchitis. We certainly don't want that to happen in Barbados. Our job is to protect the citizens of this country. And so, Gray, there are a list of products that are found on the shelves that contain ibuprofen. Motrin is one of those. Advil, Ferrofin, and they come in different strains. Of course, Advil comes in different dosage forms. You get the Advil liquid gels, the capsules, the tablets, or the tablets. At this point in time, if you are going to take this medicine as prescribed by your doctor, and you're having signs of coughing, breathlessness, tiredness, dizziness, and high fever, my advice is to have close consultation with your doctor before you take any of these products. There are other products as well that I would advise and caution Barbadians at this point in time before they take to consult their doctor. Ataric, and that comes in 150 and 75 milligrams. Naproxen, Celebrex, Voltaren and Cataplan, diclofenac tablets, Arcosia, and the very popular aspirin, as we know it, acetylsalicylic acid. There's also one called Mobic. These drugs all fall into the category of non-steroidal anti-inflammatory drugs, and they are not supposed to be used at this point in time. I suspect if you are getting fever, headache, and dizziness and coughing, you should consult your doctor. There are a lot of other medicines, Panadol, acetaminophen, toilets. There are also other medications used for pain and fever, Panadine and cocodamol. But again, I'm advising all Barbadians to keep first consultation with their physicians at this point in time. And I suspect if we adhere to the Ministry of Health warnings and regulations that we should not be encounter any adverse problems or side effects that can be harmful. And that is my word and my caution as a pharmacist, certainly.
I really want to thank you for that. I think it is so important at this time. I don't think we want to put undue strain on our health officials at this time at all. I mean, generally speaking, but this time especially. So I want to thank you very much for coming in on that.
But I also want to say, Corey, is that I'm also advising Barbadians, along again with doctor's advice and consultation with your medical practitioner, to increase their dosage of vitamin C, the antioxidants, and you would all Barbadians who certainly listen to this radio program would have heard Dr. Elliot Duggan speak limpidly about the antioxidants and the beta-carotenes and the importance of them in terms of building the immune system. And right now, it's important to build the integrity of the cells in the body. The beta-carotene, the trace minerals, there is an important and essential source of iodine found in drinking water. At this point, I would advise all Barbadians to drink up to 6 glasses of water a day in this current condition. Zinc, very important again. Zinc lozenges, the zinc is found in other multivitamin complex between 25 and 50 milligrams. It helps with, again, building the integrity of the cells, which helps you to resist viral infections. Coconut water, very good source of potassium. 1 glass of coconut water can deliver up to 600 milliequivalents of potassium. Very important for the body again. Vitamin E, lycopene, which is found in tomatoes. You can use lycopene in juice or the tomatoes, the freshly picked tomatoes, the ones that are washed and cleaned. Perfect. The beta-carotene, vitamin D. These are essential vitamins to be taken at this point in time. My appeal today is to build your resistance, because you must be important cause in fighting off any infection, not only the COVID, but any viral infection. Again, for the natural products, the lemongrass, lime juice, orange juice, grapefruit juice, tamarind juice. All those things are high in natural vitamin C, turmeric, ginger. You said the coconut water before. Lettuce, cabbage, all green leafy vegetables. It is very important for us in this country to be taking adequate amounts of green leafy vegetables, a lot of liquid to supplement in these, not only in these dry times, but also it's very hot. And it's important to rehydrate, take your natural products, and get lots of rest. But again, because of medical idiosyncrasies, a lot of persons in this country can't take vitamin C for whatever reason. It may be acid indigestion. It could be a whole series of reasons that you can't take these products.
I think the main point has to be, and I want to underscore and reiterate this for you, is this. Consult your doctor, not your friend, not Google, not WebMD. Consult your doctor. I don't think you could put it any clearer than that.
No, you have to consult your doctor, but I think that we have the resilience. We need to follow instructions, the instructions of to observe the regulations as it relates to curfew is very important to avoid community spread. Barbadians have to understand that we have to do it together. A country that prays together stays together. And then on the last closing, Corey, the last 2 lines of the chorus of our national anthem: strict guardians of our heritage, firm craftsmen of our faith. We have to do this together, understanding that we ourselves will pretty much decide our future. We have the medical team there. We have a government that is going to do everything humanly possible to ensure that we protect the lives of our ordinary Barbadians. So I want to give the calm assurance today that this government is working over and beyond the call of duty to ensure that we try to protect the lives of every single Barbadian. And that note, Corey, I want to tell you to have a blessed good Sunday. I know you are a pious individual, and I know that you would get in your worship, but we ask the whole entire nation to help come together and pray, because we can only do this thing together, you know?
I say it, and I say to that, I say amen. Lots of questions coming in here, if you could take this medication by itself, etc. And I don't think we can answer all these specifically. All I would do is to say again, consult your doctor. Mr. Carter, 2 questions specifically for you as we head towards the finish line of this program. There are some Barbadians overseas messaging and asking if Barbados has any plans to send any flights for them, as JetBlue had canceled their flights coming here. If there's food being shipped here, Barbadians can get on those flights coming, etc., etc. Any plans to get some Barbadians home that feel stranded?
As far as I'm aware, there are no plans for rescue flights or for flights to repatriate Barbadians. I think the advice has been that where persons may be overseas, that they should stay where they are and follow the advice that is being offered. In any event, the availability of flights, Barbados obviously does not have a national airline, and the availability of flights is going to be the limiting factor in any event. So the advice would be to stay where you are and to follow the advice of the healthcare officials and try to protect yourself until such time as commercial flights resume and that we are able to offer the availability of those flights. Just one thing to reiterate, anyone coming into Barbados from those countries that have been identified is going to be required to go into mandatory quarantine.
Okay, good. All right, so one of the things that continue to come up here about the coconut vendors, vegetables, and alcohol, I believe that will fall under probably takeaway. Driving instructors, I would say no. Is ice cream an essential service? So many questions. It is almost, I don't know. I think we should follow the generalization given by the Attorney General. Is if you're providing an essential service, if you're not getting into the idea of public contact outside of that, that is the rule of thumb to get us through this.
The Attorney General made it quite clear. You start from the principle all businesses are closed.
Yep.
And then
the exemptions are correct.
Move to the stage where exemptions are given for those very specific things that are required either to support essential services or in themselves constitute essential services. So if you start out from that position, all businesses are closed, and the rationale has been made very clear, then you hopefully would be able to eliminate some of the range and variety of things that are coming before the AG for consideration. Correct. Because if the Attorney General were to grant the number of exemptions that have been requested, then the entire Barbados would open.
Correct. It would be no different to 2 weeks ago. Yeah?
Because they don't have any quarantine.
Correct. Now, people saying there's some confusion as police are actively presently at the present asking people to leave the beach. There's an unconfirmed report, but I think these are early days, and I think that behind the scenes, the powers that be and the implementing agencies' communication will get on one page. This is a first for Barbados, and I would like to urge Barbadians on your behalf, panel, to work along with us and be patient as we get all these things in place. Any burning comments from anyone, because we got to close off right now? AG, Czar,
just one
CMO.
comment. I'm very glad I did not have to come to the studio today so that we are practicing physical distancing. Thank you very much for allowing me to stay in my home and participate. But we recognize that did not in any way diminish from our ability to interact with guests. This approach is consistent with what the government is asking for. And to the extent that people can work from home, as your panel just work from home, I think we can make significant strides.
Excellent. Let me thank all of you. Go ahead.
Hey, if I may, earlier in the program, we talked about physical distancing, which was the public health underpinning of what it is we're trying to do. Not to be all and end all, but it's a start in the right direction. What I wanted to add is that physical distancing, which we previously referred to as social distancing, is a non-pharmacological or pharmaceutical intervention, but it is not the only one. So we have to talk about hand washing, which we mentioned a couple of times. We have to talk about respiratory hygiene, which is important. We also have to remember to avoid touching your face, which I also talked about. And we also have to avoid places if we're unwell. If you have respiratory symptoms, you have to alert your healthcare provider. You have to avoid going to work. You have to avoid interacting with other people. All of those are interventions which together can help effectively prevent and control the spread of COVID-19 in Barbados.
Now, many questions here unanswered. I'm going to take it upon myself to work from home and get these questions up on our Facebook page and answers based on what you said today. Let me thank from the bottom of our hearts here at Voice of Barbados, Attorney General Dale Marshall, COVID Czar Mr. Richard Carter, and Chief Medical Officer Dr. Anton Best. Thanks to you, Dennis, producer and technical operator. Thanks to the entire technical team. And of course, thanks to Williams Industries Incorporated. I've been your host, Corey Lane. Do enjoy, and please stay safe, stay home.